Let's walk a little bit through resurfacing history, if you guys don't mind. We're working chronologically from left to right, really over about a 30-year time span. Now, one of the things that you'll see along the timeline as we move across is that when we talk about CO2 laser, we're talking about full field resurfacing. We're talking about pretty tremendous degree of damage that you're creating at that time. At the time, though, there wasn't anything else. And then it evolved. So when we came out with the first Erbium laser, our success was built on the fact that we took the pluses of that product, of CO2, and we corrected for all the minuses of it. And when we came out with it, it became popular because, like a lot of our products, and I think that'll be the ultimate transition into tribrid, is that we're always trying to create something new or make something better. So this is just resurfacing, though. This isn't all a history of Sciton and the things that we've done, but what really changed everything for us was HALO. Because HALO wasn't just a better mousetrap, it was a completely different thing that nobody had ever done. I don't even know that anybody really at the time besides us even had conceptualized it. You'll see now that there's a couple of these multiple wavelength systems that are out there, but really none of them really do what HALO did. Then we came out with MOXI. So MOXI, it was different, although not everybody has just one thing. Not everybody is simply just a MOXI patient or a HALO patient. And customers now start trying to take both of them and do them separately. And because they started to recognize, listen, there's probably an advantage to combining both of these together because you've got the right wavelength for something over here, the right wavelength for something over here, but we got to get those things together so we can apply them to every patient. That's how we evolved into this product, tribrid. So when we say results matter, that's what we really mean. We recognize that it's not really us. It's can we build a product that is drop dead, better than everyone else's, and will that product turn into something that we think will have a 10, 15-year life and that will carry on and carry on and carry on? That's where we are today, because I don't know how we're going to improve upon where we are now. The why is, how do we take MOXI, how do we take HALO, how do we put it together, and not just put it together, but have it do things that they don't do as they stand by themselves. That's how we got to this. That's how we got to this product. That's the why. And let's get into the rest of the panel and have some fun.
So one of the things that we were talking about in the back of the room is, when do you add adjunctive technology, resurfacing, tribrid, whatever, off the face? And I think the next year is going to tell us quite a bit of using these technologies off the face.
The coolest thing for her that she was so happy about, show the next slide, is that this textural improvement after one treatment.
Also the speed. I mean, speed is very different. I think it was too long to do HALO on the chest previously, but with the new tribrid, it's so much faster. It's just.
I mean, once you see that, if you're a HALO user and you use the tribrid, it's a different animal. That thing is way faster, way faster. And one of the things Dr. Negus in the back heard, because we were at a couple of meetings over the last few months, and the one complaint he had from some of the world's laser people is that HALO was too slow. Mm-hmm. And he took that to heart, and he really pushed everyone to make it faster, and you guys really have. Really good. All right, Sherrif, let's see what you got.
So she happened to come to the clinic the day after we received the tribrid, earlier in this calendar year. And of course, we're going to start with BBL for her, just given the amount of pigmentation. But if you look on the cheek, right cheek there, you can see those are thin SKs. Yeah. And that typically would have been something we would have maybe addressed with MOXI on top of the BBL, but you also had some of the vertical lip lines there that required a little bit of resurfacing.
So before you got tribrid, and to me, I'm still looking at her like, Kevin, would you say I would TRL her? Because I mean, to me, the question is TRL is what's her downtime compared to tribrid? TRL is going to be longer, but I'm looking at her and I don't like the lines under her lower eylids. And I don't like the perioral line. So I think if her goal is to get rid of her perioral lines, that's TRL. But what Sherrif said was very important. What's her downtime? And she might not have the downtime for TRL. And I think that's where tribrid really plays.
I think everybody on this panel would want to TRL her.
Right. Yeah. But it's about half the downtime. Tribrid has about half the downtime, if not more.
Yeah, but also it's very different downtime. There's no wound care. There's no
intensity
injected anesthetic. There's no post-op care.
And you see the slightly different plastic surgeon versus dermatology. I think in dermatology, the patients that you're seeing are often don't want the downtime, and we can maybe talk them into a little bit more downtime because often they're having adjunctive procedures. But the other thing is, and maybe Sherrif can comment on this, I heard a talk by Matt Avram talking about when you did any of these laser procedures, you were reducing their future skin cancer risk. Can you comment on that?
Yeah, a lot of that is retrospective data. They did a chart review looking at people who were high-frequency skin cancer patients and those that had a non-ablative resurfacing that had fewer cancers over time. But in reality, I think we have to do nice prospective studies and first see if these things can reduce the number of AKs at baseline. I think that's where we are. So
let's see what you did. You know what's interesting? Look at your settings, okay? Pretty aggressive settings. They're not crazy. But look at the lines around her mouth. That's what's surprising me, that you got a really good result there without having to get to the level. I would have probably taken her down to 800 microns around her mouth. Kevin, you agree with that? About 800?
Yeah.
So that's a really good result for around the mouth, and that's the hardest area. So when you compare, let's say, tribrid to CO2, fractional CO2, the one weakness I think that fractional CO2 has is I think it's terrible around the mouth. I think it's not bad around eyelid tightening, but I think for perioral iridids, CO2 is horrible, horrible. When we first got this, all of us were at these settings for 1927, and it was interesting to watch Chris, myself, and Sherrif progress through the settings over time. We've had this laser about 5 or 6 months now, and the 1927s went from 10, 15, 20 to like everyone gets 40 now just because we can. And we're not really seeing that much extra downtime with it, and we're seeing better results. So that's the progression that we've learned, and maybe we'll back off, but we've seen he's like, this is nothing compared to what we use now.
correct.